Hi, my name is Dr. Aisha Baron. I am a board certified plastic and reconstructive surgeon, and the object I brought is a breast implant.
Can you describe your object?
So, my object here is a silicone breast implant. Breast implants are commonly used in order to augment the size of the breast or to reconstruct a breast after it's been removed for something like breast cancer or breast disease.
For those unfamiliar, can you explain what a plastic and reconstructive surgeon does?
A plastic and reconstructive surgeon is a surgeon that performs a variety of surgical procedures. They can range from cosmetic surgical procedures or reconstructive. Most commonly, people are familiar with cosmetic surgeries such as breast augmentations, facelifts, tummy tucks, liposuction, and BBLs or Brazilian butt lifts, things like that, and also Botox and fillers. However, the core of plastic surgery is reconstruction. As a board certified plastic surgeon, I performed or completed a accredited plastic surgery residency. And so, those core principles and foundations of being able to reconstruct almost any defect that comes across my way is something that's been ingrained with me. Reconstructive procedures can range anywhere from reconstructing a cleft lip and palate on an infant, or extensive cancer reconstructions for patients who have been diagnosed with cancer, also trauma reconstruction, and also hand surgery.
Can you explain what it means to be board certified?
So, board certification means that a surgeon or a doctor has been extensively tested and examined on safety and ethics as it results to the practice of medicine or surgery. We undergo a litany of tests, written examinations, and oral examinations in order to ensure that we practice and uphold the standards of our specialty and that we practice with safety, ethics, and morals in mind as we treat our patients.
What does a typical workday look like for you?
A typical work day can vary for me. Some days I'm in the operating room, and some days I'm here in my office. If I'm in the operating room, that workday can start anywhere from 7 to 7:30 a.m. and go all the way to, maybe 2 p.m. or sometimes even 5 or 6 p.m. depending on how many procedures I'm performing and the length of the procedures. If I'm in the office, normally my day starts at around 8 a.m. and then I'll see patients periodically throughout the day, typically until about 3 or 4, and then I'll have some admin stuff to do until about 5.
How does your object aid in the everyday task in your industry?
So my object, my breast implant, it aids in helping to restore or really transform a patient's breast. A lot of times we have patients who come in for primary breast augmentations. That's to increase the size of the breast. And so breast augmentation is one of the most common plastic surgery procedures. It can really transform a patient's sense of self-esteem, femininity, sexuality, and really give a confidence booster for someone who's wishing to be a little bit larger on top. The other role that a breast implant plays is one that's super significant and near and dear to my heart and my practice, and that's to potentially reconstruct a breast after a patient has been diagnosed with breast cancer. And so there's several methods of reconstruction. One of the most common is performing reconstruction with a breast implant, such as a silicone implant. Sometimes that takes a one-stage or a two-stage procedure, but it can be transforming for a patient, especially if they were not initially able to have a reconstruction and then they're able to do so after their treatment is completed, or whether or not it's done at the same time of their cancer treatment. So this little breast implant, is one of the workhorses of plastic surgery, and I'm actually fortunate enough to have been trained at the program that started or invented the first breast implant, which was in Houston, Texas at Baylor College of Medicine.
Can you share a memory attached to your object?
Oh, Lord. um, So the memory attached to my object is that I trained at Baylor College of Medicine in Houston, Texas, and that's where the pioneers in breast implant surgery created the silicone breast implant. And so while I was in training, I actually had the opportunity to do an article or interview with the patient who had the very first pair of silicone breast implants placed in her body. She actually still had the same implants in place, and they had been in there for 47 years. They weren't the most comfortable for her, but she had lived her life and wasn't interested in any more surgeries to get them removed or exchanged. And it was actually that the implants were offered to her as an add-on operation. She actually wanted to get tattoos removed from a previous relationship. And so the surgeons that were treating her asked, like, hey, do you want to try something? It's something new that we're, interested in doing here. So, would you be willing to try putting an implant into your breast? And she said, sure. It was a really eye-opening and really historical moment for me, especially as a trainee, to be able to get to meet her. And, it really kind of solidified the history that's associated with plastic surgery. And it made me really grateful to have the training that I have, being that I was around all these pioneers.
Last question. If you could give one piece of advice to someone considering plastic or reconstructive surgery, what would it be?
If I could give one piece of advice to someone who is considering plastic and reconstructive surgery, I would say if it's an elective procedure, meaning that it's not medically necessary, make sure that you're doing it for the right reasons. Make sure that you have the correct motivations. Plastic surgery is meant to enhance and augment and add to something that's already there or create something that wasn't there before. It's not going to transform your personality, who you are on the inside. It's not going to give you the job that you always wanted or get your boyfriend to come back or your girlfriend for that matter. So I think it's important that patients have the correct motivations and that they're doing it for themselves and not for someone or something else. If a plastic and reconstructive surgery procedure is for medical reasons, make sure that you do your research. It's very important that you have one or two second opinions in order to make sure that you're getting all the options that should be afforded to you. Sometimes with breast reconstruction surgery, patients may not be offered breast reconstruction at the same time as their mastectomy when it comes to breast cancer. So, and we also know that patients of color are at a disadvantage when it comes to being offered these reconstructive procedures. So it's important to do some research, do a Google search, talk to friends and family, because sometimes having a cancer diagnosis can be a very vulnerable time for a patient, and you can feel like you're overwhelmed with so much information and things that you have to do. And so best thing that you can do is be an advocate for yourself and really ask about all the options that are out there for you.